Today's topic of presentation is ferrule and ferrule effect. What is ferrule? Ferrule is the band of extracoronal material at the cervical margin of a crown preparation that encompasses the tooth and provides the resistance form to the tooth. So, what is resistance form? Resistance form is the quality of the preparation that prevents the rotational movement of the crown. The crown preparation without the resistance form can easily be rolled off the die, whereas preparations with resistance form prevents the rotational movement of the crown and provides the unidirectional insertion and removal of the crown over the prepared tooth surface. What is ferrule effect? The ferrule effect occurs because of the crown bracing against the remaining supragingival tooth tissue. And in this figure, we can see that the crown is bracing over the prepared tooth structure, hence it provides the bracing effect, which is also known as the ferrule effect. So what are the dimensions of a ferrule tooth structure? The tooth structure to provide the ferrule effect must have 1 to 2 mm of height and 1 mm of the width for the margin. So what is the significance of the ferrule? The ferrule improves the fracture resistance of the tooth structure. And can we keep the same dimensions of ferrule around the circumference of the particular tooth? The answer is no, because it depends on the stress distribution and the circumference of the same tooth. In this figure, we can see that the buccal cusp of the lower molar is occluding on the palatal cusp of the upper molar. So, during occlusion, the stress is more on the buccal cusp of the lower molar and on the palatal cusp of the upper molar. So, the ferrules shall be made longer on the tooth structure surface where the stress is more. Can we keep the same dimensions of the ferrule on all the surfaces of the maxillary and mandibular teeth? The answer is no, because we have two dimensions of the ferrule to be kept, and the first one is the shorter ferrule and another one is the longer ferrule. The dimension of the shorter ferrule is 1 mm, whereas the dimension of the longer ferrule is 1.5 mm. So it should be placed simultaneously on the basis of the stress distribution and circumference of the tooth. So in case of the maxillary and mandibular incisors, the stress occurs more on the palatal surface, so longer ferrule shall be made on the palatal aspect of the maxillary incisors. Whereas in mandibular incisors, the stress occurs more on the labial surface, so longer ferrule is placed on the labial aspect of the mandibular incisors. And in case of maxillary and mandibular teeth, shorter ferrule could be accepted mesially or distally due to decreased stress distribution. So this is how we place the ferrule on the tooth. So the references of today's topic is Grossman's Endodontic Practice, 13th edition, and Rethinking Ferrule, a New Approach to an Old Dilemma. And this is the journal where we have taken our seminar from. So these are our references. Thank you for watching this video till the end, and please subscribe to our YouTube channel, Dental Tuition. Thank you.